So the drug has powerful activity. Heparin also works well. The only way to get to the bladder is with a catheter. We use it routinely. I'm going to just talk about studies or drugs that I've worked with that I found to be very effective. Dr. Theodoridis convinced me about 1988 that Atarax was a great way to stabilize mast cells. What are mast cells? He's going to tell you what they are. They're the allergy cells. They make histamine, and histamine drives the bladder nuts. There are cells in the bladder wall that will make tons of it, and this drug prevents the production or the release of the histamine. So when you combine just Elmron and Atarax together in a simple therapy, on the bulk of patients that I see, I'm going to say 75% will get better if you wait a year at that time frame. Most people stop it too soon, but I never stop it. We do what we call multimodal therapy. If you're not getting better, we add more. If you want to add other drugs, quercetin or pre-leaf or whatever else, and if it's giving you relief, take it. We don't believe in just monotherapy. The more drugs you take, the more likely you'll get relief of your symptoms. Obviously, if one drug is relieving all your symptoms, you don't have to worry. So multimodal therapy. The question is, what do you do? Many of you probably are past that point. That's why you're here today. You're the one out of 400, maybe. Maybe some of you are in the mid phase. Can we help you? We can help just about, I'm going to say 90% of the patients that come through our door. And I said 1980, I was lucky to help 23% of the patients I saw. Help. And now I'm going to say, I've got my nurse here to back me up, 90, 95%. Get better, stay there, maybe flares, but none of this misery 724 for months and years on end. And the last big breakthrough we've had in therapy, something I couldn't do to someone who was sitting in front of me 5 years ago, I could say, give me a year, you're going to be a lot better. We're going to try and add together different drugs. But I couldn't say, you're going to be better when you leave my office. I tried different things. I tried anesthetic agents, which people talk about. But what we didn't know was that you can put an anesthetic agent, the same one the dentist uses, lidocaine, into a normal bladder, but it doesn't do much because it doesn't get absorbed into the bladder wall. The marvelous mucus keeps it out. Sometimes it doesn't help, unless you play with it a little bit. If you add sodium bicarbonate to it, which is an alkali, the form of lidocaine changes. And lo and behold, it absorbs through the bladder wall. So where there's almost zero absorption, you add the little bicarb, and in about a 20-minute period, you absorb about 40, maybe 50% of it. And you anesthetize the bladder. Now you add heparin to that milieu, because that just settles the nerves down. You add heparin, 40,000 units, you combine that therapy, and we studied this and was published last year. We call it the therapeutic solution. We used it 3 times a week for 2 weeks, and we also checked people the next day. 1 treatment. The next day, we had 94% of the patients get a good response. 94%. That lasted between, half of them had relief from 4 to 40 hours, way past its anesthetic effect, because it's downregulating those nerves that are active. It's the only drug that I know that'll do that and not get a rebound effect when it wears off. You use a narcotic to do that, you get relief, but when that narcotic is gone, bam, that thing rebounds and its pain's worse than ever. So we then studied the patients for 2 weeks. We took all comers coming through the door. At the end of 2 weeks, 80% had obtained good, sustained remission from treatment to treatment. That's just 6 treatments. That, to me, is a huge breakthrough in getting therapy induced. Now we carry them with Elmron. I mean, if they don't go on the Elmron, stay on it, then you don't have that mucus-fixing agent. We truly believe you need something to fix the mucus as the cornerstone of your therapy. So right now, that's the mainstay solution that we have. It's not widely used, but I don't know if any of you here have tried it, but for the very severe patients, you're going to need to use it yourself. We teach you how. Do it you can do it 1, 2, 3, or 4 times a day. If it's only 2 hours worth of relief, it's usually a pretty good 2 hours. Then you use it every 3 or 4 hours. And you say, I can't learn how to do that. Well, we had a little 9-year-old girl come in May who'd been in diapers since she was born, basically. And she had been 4 years of bad pain, see several urologists, and they want to take her bladder out. And so she came to see us, and she had been really treated or studied a lot, and trying to put a catheter in her bladder was a nightmare. But we talked her into it, and I came in the room later, and I said, how do you feel? She had a big smile and thumbs up. I said, I guess we're feeling better. And her mother says she's feeling great. And within 3 weeks, she would only let her do it once a day, but within 3 weeks, she asked her mother to teach her how to do it, 9 years old, and she's doing it herself twice a day, and at the end of 3 months, almost all her symptoms are gone. She's no longer wetting her pants, and she's dramatically better. So don't tell me you can't learn how to do it, because you can. We have a lot of tricks. Sometimes it's not that easy, but we encourage you to do it. Urethra hurts. Half of you have urethral component to this disease, and it doesn't tolerate catheters. I don't have to tell you that. You must have discovered that somewhere along the way. So what we do and out there is advertise a catheter. And the reason that we ask the people here is because we've tried all different types of catheter, and that catheter is the best tolerated by your tender urethras. But what will happen as the weeks go by, your urethra gets a lot less tender. And then it gets to be easy to catheterize. So that to me is a big breakthrough at therapy. I think between the therapeutic solution, Elmeron and Atarax, we can get better 90 to 95% of people and keep them there. And if you have a flare, we just give you one treatment, the therapeutic solution. It usually settles it down, maybe 2 or 3 treatments. It'll settle it down.